Welcome everyone. I am Alexandra Newlands at the Sun Civil Society Network Secretariat, and I wish you all a very, very warm welcome to our N4G side event on accountability beyond the summit and beyond the year of action. It's really nice to see all of you. We have a great lineup of speakers today. And as people are joining in, I would like to start by saying a few logistical points first. So I think you will all be on mute for the moment, but rest assured that we will do a question and answer session later on where you can share your questions and comments with the panelists. When you do so, please address your questions to a panelist in particular if you have a direct question, so we know who to address it to. You can use the chat function as well as the Q&A function, which you will find at the bottom of your screen. You will also see a globe for the interpretation. So if you are a French-speaking or Spanish-speaking member, you should be able to switch to the relevant language. So before I give the floor to our moderator, I just want to start with a little participatory exercise as people are joining in. Could you please log in to this link and my colleagues will kindly post the link into the chat. Or you can also use your smartphones with the camera option and scan the QR code, which you'll find on the screen, because we want to find out what accountability means to you. We'd like you to write just a word or a very short sentence about what accountability means to you, and we will ask you the same question at the end of the event to see if that's if the word accountability means something different to you. So I'll stop for now. I'll let you go onto your phones or onto this link. If my colleagues can post the link on the chat. Thanks, Zoe. And I'll just give you a couple of minutes to answer and we'll see the results together before we start. Thank you. Thanks, Zoe. So for those of you joining now, before we start officially the event, we are asking participants to write down in a few keywords what accountability means to them. You can follow the link posted in the chat box to let us know what you think in any language. Feel free to answer in French or Spanish as well. And I see many coming in. It's lovely. All right, thank you very much for all the answers that you've submitted. So I hope you can now see on your screen the results that are coming in. And please continue to answer if you haven't yet. So accountability, just to name a few, for you means sustainability, actions, just not just words, trust and confidence, define metrics. Accountability means keeping promises made with concrete actions, doing what you say you will do, responsibility, open, transparency, and trust. I'll read one in French as well. La première pratique de bonne gouvernance qui donne les moyens à chaque partie prenante de contribuer en fonction de sa fonction et de son rôle pour l'atteindre d'un résultat multisectoriel. Being able to explain clearly what you're doing and responsible for. And I'll pick a last one. Citizens are informed on their rights and can engage duty bearers for redress. Duty bearers are responsive to citizen engagement. So these are just to read out a few. And we will ask you the same question at the end of the event to see if you feel differently about this word. So let me now go back to the presentation. And thank you very much for your contributions. It's very interesting to see how everybody feels about accountability. Just to share the definition from the dictionary, accountability is the fact of being responsible for what you do and able to give a satisfactory reason for it or the degree to which this happens. And social accountability, I included that as well because we'll be receiving quite a few examples from different countries on social accountability. It is a form of civic engagement that builds accountability through the collective efforts of citizens and civil society organizations to hold public officials, service providers, and governments to account for their obligations with responsive efforts. Based on voice rather than votes, social accountability initiatives provide a channel for direct political participation. And now, so yes, just to list a few examples, and you'll hear some from our panelists today. The instruments of social accountability are varied and can include many things such as social audits, citizen report cards, community scorecards, public hearings, citizen hearings, a simple meeting with your government leader, traditional feedback mechanisms such as focus group discussions, and other citizen-led mechanisms such as community management. And so this was a way to just bust the jargon. Accountability can be a scary word. We use it a lot because we want to see actions from promises made. So it can be a scary word, but in fact, it can just mean interacting, entering a constructive dialogue between you as citizens and those that have made promises on services that they would deliver or on budgets that they would use for specific interventions. So with this introduction, I will now give the floor to our moderator, Aminou Magashi Garba, Global Co-Convener of the Community of Practitioners on Accountability and Social Action in Health. Over to you, Aminou. Thank you.
Thank you very much, Alexandra. Hope my connection is good. All right.
We can hear you well.
All right, thank you. So let me use this opportunity to welcome the organizers of this webinar, Scaling Up Nutrition Civil Society Network, and also to welcome our distinguished panelists, who I will introduce them later, very soon. And of course, also our distinguished participants who have joined to listen and participate to the interesting and robust conversation around nutrition for growth accountability beyond the nutrition for growth. How can we support commitments makers to deliver on their promises? We are going to have a very interesting discussion over the next 90 minutes. So please stay tuned as we run through the program. Permit me to share the objectives of this event, which is to ensure momentum doesn't stop at the Nutrition for Growth Summit and informs accountability efforts at global and national level towards more policy and financial investment in nutrition specific and nutrition sensitive activities in the future. And of course, to also inform a charter on accountability from civil society with measurable guidelines to ensure nutrition accountability framework is used and that effective mechanisms are put in place to hold commitment makers to account. So this is the overall objectives of this meeting. And also to, like I said, I want to quickly introduce the panelists so that we know their names and also who they are. And also we'll be gradually introducing them to make their own presentation. We'll be hearing shortly through a video message from Dr. Satoshi Ezoe, Director of Global Health Policy Division, Government of Japan, Ministry of Foreign Affairs. And also we'll be having a short presentation from Shane Cunningham, Advocacy and Youth Advisor, Civil Society Network for the Scale Up Nutrition. Then we'll have 5 distinguished panel speakers that will be speaking for 4 minutes each. Besinati Pefo, Technical Director for Social Accountability, World Vision International. Dr. Jibran Bagayoko, Son Focal Point for Mali, Head of the Nutrition Coordinator Cluster, Ministry of Health and Public Hygiene. Horn Kroin, Helen Keller International, Deputy Country Director, Cambodia. We are going to listen through a video message. Speaker number 4, Mike Kunga, Son Civil Society Network Youth Leader for Nutrition, Malawi. And the last but not the least, Ismail Bamo, Managing Director at Society Day Transformation Alimentary STA. So these are the our distinguished panel speakers. But before we have those robust discussion, we are going to have an opening remark through a 3-minute video message from Dr. Satoshi Ezoe, Director of Global Health Policy Division, Ministry of Foreign Affairs, Government of Japan. So please, Alexandra, go ahead to show the video. Thank you.
Thank you very much, Aminu. I just want to pause here because I am reading that the interpretation into French is not working. Alejandra, is that something you can support with, please? À tous les francophones dans l'appel, je suis vraiment navrée que l'interprétation ne fonctionne pas. J'ai demandé à notre interprète, Alexandra, de voir comment régler ce problème au plus vite. Voilà, toutes mes excuses. J'espère que Alejandra sera capable de fixer ce problème. On va continuer pour l'instant avec le webinaire et j'espère que Alexandra pourra fixer en attendant. Oui, peut-être, juste pour s'assurer, si vous allez en bas de votre écran, vous verrez un globe, une map monde, et vous pouvez sélectionner la langue française en cliquant sur FR. Peut-être vous êtes sur encore sur le réseau anglais. Donc, si vous allez sur le globe et puis vous cliquez sur FR, vous devriez pouvoir entendre la traduction en français. Okay, so I'm now going to share the opening remarks by the Director of Global Health and Policy Division from the Government of Japan.
Distinguished guests and colleagues. I wish to express my gratitude to Sun Civil Society Network and ICANN for giving me the opportunity to join you today for this important official side event of Tokyo Nutrition for Growth Summit 2021. The summit strives for mobilizing commitments to improve malnutrition globally. Building on previous N4G summits in London and Rio, the Tokyo N4G Summit will contribute to further strengthening a culture of accountability for commitments made to ensure action translates to impact. We provide a comprehensive commitment guide for all stakeholders. It gives you concrete guidance of how to develop a commitment, which is guided by the SMART criteria: specific, measurable, achievable, relevant, and time-bound. The application of SMART criteria ensures that the type of the commitments, such as financial, policy, or impact, their goals and their expected outcomes are clearly articulated. This makes commitments easier to classify and monitor and makes it possible to measure impact and demonstrate success. In order to ensure accountability for nutrition interventions and policies that will be committed at the Tokyo N4G Summit, we have closely worked with Global Nutrition Report, GNR. GNR's commitment tracker provides the latest data on progress made by governments, businesses, civil society, and other actors towards commitment to improve nutrition. The commitment tracker will show the progresses of each commitment. This makes it an important resource for anyone who needs evidence to shape stronger commitment on nutrition. I'd like to take this opportunity to extend my sincere appreciation to GNR for their great contribution. Ensuring accountability and enhancing data systems are key for success. Over years, Japan has worked to review how nutrition can be optimized and monitored across its population. The world's first nutrition research institute, established in Japan in 1914, contributed to the analysis of the ingredients of major foods, preparation of data, and the establishment of standards for nutrient intake. In addition, through surveys and research by research institutes, Japan has accumulated scientific data that is the basis of nutrition policy and nutrition research for over 100 years. Such experience is one of the reasons why we set data and accountability as a core theme of the Tokyo N4G Summit. I believe today's session will bring good and well-balanced nutrition to millions of more people around the world through ensuring accountability processes for any nutrition-related interventions. Furthermore, I look forward to welcoming you to the N4G Summit on December 7th and 8th with your ambitious commitments to fight all forms of malnutrition. Thank you very much.
Thank you very much, Alexandra, for presenting the short video. We heard from the government of Japan a very clear direction and commitment and a demonstration of leadership from the government of Japan on nutrition, and also emphasis on the commitment tracker tool to support countries that commit and partners to promote monitoring, learning, and also remedial action based on the commitment. We appreciate this powerful speech by the government of Japan. And I would like to go right away to invite Shane Conihan, Advocacy and Youth Advisor, Sun Civil Society Network, to share learning from others. You have 5 minutes to make your presentation. Shane, you're most welcome. Please, you can proceed. Thank you.
Thank you very much. Now I'm just going to share my own screen. So hopefully this works fine. So hopefully now everyone can see full screen accountability case studies. Can I just get a quick confirmation?
We can, yes.
Brilliant. Thanks, Alex. So as has been mentioned previously, it's really important that we look to examples of where accountability has been carried out really effectively so far. And so prior to this event, we reached out to our partners, our colleagues, our friends in civil society, and really asked for people to share their own examples of where accountability has been effective. And what we've started, and certainly haven't finished, is building this map of case studies that we can hopefully start to form a bit of a database and for people to kind of to learn from and expand upon. So I'm going to talk you through what we've got so far, but really want us to see this as kind of the starting point. So I'm going to talk you. We've got a few examples here, but I'm just going to talk you through 4 that I think are particularly interesting and worth learning from. So let's just zoom into El Salvador. So this is a really great example of constructive collaboration between government and civil society. In the lead up to the UN Food Systems Summit, the Sun Civil Society Alliance, which is known as Alianza Nutres, I hope I've pronounced that correctly, in El Salvador, worked really, really constructively with the government to make sure that there were going to be some really strong commitments that the government could showcase at the UN Food Systems Summit, and work with them to develop a roadmap to implement these commitments as well. And what we saw during the summit was actually a huge show of support from the government by putting forward the First Lady and the Ministry of Health and Food Security and other ministries to showcase the commitments that they were making. And we saw really strong outcomes on interventions around breastfeeding and food security, moving forwards, there's now a really strong working relationship between the Sun Civil Society Alliance and the government to make sure that those commitments are going to be upheld and implemented effectively. So it's a really great starting point for El Salvador. I'm really excited to see how that roadmap gets played out. So let's just zoom out and have a look at Burkina Faso. So this is a really great example of civil society leading the accountability mechanism and jumping on a government initiative to make sure that it can be that they can strengthen it and make sure that the results are exactly what the government is looking for. So since 2016, the government of Burkina Faso has been scaling up the exemption of out-of-pocket payments for patients from patients for children under 5 and pregnant women for all healthcare services, including nutrition at all levels of the health system, which is a great initiative, but it's really important that is, like I said, is effective and is actually going to be living up to the objectives. So civil society took the lead in monitoring the effectiveness, evaluating it at regular points, and then feeding back on areas where it could be improved. There's already been marked improvements that have been implemented as a result of their recommendations, there's already ideas about how this program can be extended and taken further, and it's quite likely that this wouldn't have happened had civil society not been leading the way on the accountability and demonstrating that actually this program could be really effective to the government. And despite the situation in Burkina Faso, there's been a really unstable security situation. It's really remarkable that this program has continued, and again, it can be attributed to this monitoring and evaluation that was led by civil society. So I'm just going to zoom out Burkina Faso and let's have a look at Tanzania. So this is another example of where the Sun Civil Society Alliance in Tanzania, which is known as the Partnership for Nutrition in Tanzania, or PANITA. This was really encouraging decision makers to hold themselves accountable and hold their peers accountable. So they started to engage constructively to identify national champions that could operate within Parliament, to be working really closely with the Civil Society Alliance, agreeing and understanding the advocacy objectives, and then championing them in Parliament and speaking out where it did look like the government or Parliament wasn't going to be living up or meeting those expectations. This again has been really, really successful, and they've entered a new strategic period until 2025, and it's definitely an example to learn from as well. And I think we would love to see examples across the Sun movement of where we can have these parliamentary champions banging the drum alongside civil society. So lastly, let's just zoom out and have a look at Indonesia. So this is a really nice example that was led by World Vision Indonesia. So World Vision has employed a citizen voice and action approach, which is really about kind of working at the grassroots level, empowering communities to hold duty bearers to account. It's hard work. It's not easy to kind of work at the grassroots level and really kind of get down to the detail about how citizens can hold people to account. But as you can see from this case study, the results are really impressive. So communities were empowered to scrutinise public health and education provisions against the standards that were set by national governments, and speak out and challenge where expectations were falling short. And you can see there's been a 41% increase in the percentage of community members who have heard of the minimum standards for maternal and child health services. We've also seen an 18% increase in the proportion of pregnant women and mothers who are aware that antenatal care should be provided at public health. And as soon as they're aware of their rights and what the expectations are, they're much more able to challenge these service providers. So that was a very quick whistle-stop tour. I'm aware that I might have spoken a bit too long there, but I really hope that that's given you an insight into the kind of the work that we're trying to do within the Sun CSN. Really want to build up these case studies, and we're going to put this live on our website. And I really encourage anyone else who's watching this who has a really interesting case study to share. Please do share with us, and we want to see this map really kind of blowing up with case studies, and it's going to keep growing, and we want to add pictures and stories and videos, and we'll also share the link to this Prezi during the call, so you can actually, in your own time, you can zoom in and you can look at like Brazil or any of the other countries that we've started to build case studies for. So that's all from me. I'll hand back to our moderator.
Thank you very much, Shen, for this brilliant presentation. In the interest of time, we are going to move straight to the panel presentations, learning from others. So with pleasure, I would like to introduce the first presenter. You have 4 minutes, unfortunately. Besnati Pefo, Technical Director for Social Accountability, World Vision International. Please, you have the floor, and you are most welcome.
Thank you very much, Mr. Moderator, and thank you so much, Sean, for the segue into this by giving the example from Indonesia. It's my pleasure on behalf of World Vision to share some of the experiences that World Vision has in using social and accountability, including for services such as healthcare and nutrition. And I'll give an example from the nutrition sector. But since 2005, World Vision has been working with local communities using an approach that we call Citizen Voice and Action, or CVA in short. The approach has now been used in about 50 countries, and it employs the social accountability elements of information, voice, dialogue, and accountability. On the visual on the screen in front of you, on the left, you see the 3 phases of the CVA process. There's the enabling citizen engagement phase, which is about civic education on rights and entitlements. Then on the second phase, on the enabling citizen, on the engagement via community gathering, it's about opportunities for communities to feedback through the use of mini social audits or community scorecards, but also really importantly, to have spaces for constructive dialogue and collective action. And the final phase of the CVA process is all about ongoing advocacy and influence to ensure that any actions agreed upon are delivered and that there's responsiveness and accountability. At the bottom of the screen, you see a few pictures of the CVA process in action. We have tested the approach, and it has been proven to show really encouraging results. The most typical results that you will hear of are improvement in the standards of services in line with government policy, improvement in service users' satisfaction, the strengthening of health systems, as well as the overall improvement in nutrition, health, and other outcomes that are in line with the service that's being monitored. The approach has been adopted and used in a variety of sectors, but also in a variety of contexts, so urban, fragile, with refugees and also migrants. This is really important because we talk about citizens, but it's a small c, so that we can be inclusive of those communities that are often left behind. It is this approach that was used by World Vision Kenya in a project that ran from 2012 to 2016. The project was called Ensure, Enhancing Nutrition Surveillance and Resilience, and it was funded by the UK government and led by a consortium led by the International Rescue Committee, working in collaboration with World Vision, Save the Children, and Islamic Relief Kenya as partners. Now, as part of this project, World Vision in Kenya used CVA in Turkana, which is an area of limited access to nutrition services, but also high levels of child wasting. The activities that were employed as part of this project included the community volunteers undertaking social audits in about 6 health facilities, really focusing in on the issue of staffing and working in collaboration with health facility staff and also other local leaders. And this shone a light on the acute understaffing situation in those facilities, approximately 45% gap. And then there were also a number of community dialogues and interface meetings in line with the CVA process. Over the 3 years of the project, community volunteers presented information from the audits to the chiefs, to ward administrators in large community meetings, but also held quarterly meetings with leaders to highlight some of the issues that required action, such as staffing, not having drugs in hospitals and clinics, the lack of anthropometric equipment, the low latrine coverage, issues to do with water and sanitation, and so on. There was also a big problem of access and distance to static health facilities. So a number of community members were not able to access the nutrition services that they desperately needed. There were also some budget analysis and advocacy activities that complemented this work. Now, let me end by sharing some of the encouraging results that came out from this project. There were about 4 things that I'd like to share. Firstly, there was an increase in community awareness on their health and nutrition rights. And this contributed to increased demand and uptake for the services. There was also an increase in the number of health workers present in the facility. There was the recruitment that happened, but also there was the community monitoring through a youth group that was using WhatsApp to monitor absenteeism of health workers and also late arrivals. There was also 3 communities were also successful in lobbying for new clinic construction, and this brought the services closer to the communities. And where there was no construction of a facility, there were more mobile outreach services. This increased access for the treatment of severe acute malnutrition and other integrated mother and child health services. The outcome level, finally, for the 3 years of the project, there was about a 72% increase in the number of severely malnourished children that received treatment in outpatient chiropratic programs. And almost 15,000 children with moderate acute malnutrition were enrolled onto a supplementary feeding program. There's so much more we can say about this. I'll share a link to the report in the chat. But yeah, thank you. I'll end here for now. Thank you, Mr. Moderator.
Thank you very much, Besnata, for this presentation. We'll move straight to the second presentation from Dr. Jibrin Bagayoko, the Son Focal Point for Mali, head of the Nutrition Coordination Cluster, Ministry of Health. Please, can we...
merci à vous tous encore. Merci à mon introduction et je vous remercie encore une fois de plus pour donner la chance au Mali de partager des progrès importants qu'on a réalisés pour la bonne gouvernance et la culture des responsabilités de la gestion des programmes multi-acteurs, multisectoriels de lutte contre toute forme de malnutrition avec une participation active de la société civile comme acteur clé de réalité, surtout de la part du gouvernement. Cela veut dire qu'on a des acquis importants. On a fait 2 forats en 2010 et en 2019 avec des recommandations phares qui permettent de suivre la progression de l'approche multisectorielle multi-acteurs, dont un des éléments factuels est que le Mali fait partie des rares pays de l'Afrique au sud du Sahara a reculé la malnutrition chronique de plus de 10 points entre 2013 et 2018. La fonctionnalité de tous les réseaux du Scaling Up to Nutrition, les son gouvernement sous le leadership, il y a les son société civile, les son donateurs, le son secteur privé, le son académie recherche, et aujourd'hui aussi on a un réseau des parlementaires pour la nutrition qui continue à nous appuyer pour vraiment avoir ces droits à l'alimentation, à la nutrition comme des éléments de droit constitutionnels. Aujourd'hui, les documents normatifs qu'on a, on l'a fait avec la société civile, depuis la politique nationale de nutrition à la deuxième édition du plan d'action multisectoriel, aux politiques, normes et procédures qui existent dans le cadre de la nutrition spécifique. Et les cadres de redevabilité sont là. Avec l'esprit de Free One, un seul leadership qui est le gouvernement, un seul mécanisme de planification depuis les niveaux communaux jusqu'au niveau central, et un seul cadre de mesures de suivi et évaluation qui est le cadre de mesures de rendement du plan d'action multisectoriel. Et pour animer tout ceci, on a eu des groupes techniques intersecteurs de l'instruction, qui est l'outil privilégié où tous les cadres techniques, mais qui a créé aussi des groupes techniques de travail, dont un sur le plaidoyer, la communication, dont le co-lead est la société civile. Le Mali organise annuellement la revue multi-acteurs multisectorielle qui regroupe l'ensemble des parties prenantes de la nutrition spécifique. Et je peux vous donner une best pratique qui est l'analyse budgétaire qui a été faite pour l'exercice 2014-2017, qui a montré que ce n'est que 1% des ressources du ministère de la Santé partaient dans la nutrition, mais sur les 293 milliards de francs CFA, sur 47%, 47 milliards ont été financés par l'ensemble des parties prenantes, ce qui correspondait à 16% des budgets initiaux qui a été prévu. Et ceci a été utilisé comme outil de plaidoyer aujourd'hui, même pour l'exercice 2022. Le Mali a déjà inscrit les 600 millions de francs CFA pour l'achat des intrants, des aliments thérapeutiques pour l'emploi. Voici un des grands résultats que le Mali a pu avec la société civile. Mais ce qui veut dire que le Mali est déjà depuis plus d'une décennie très engagé dans l'approche multi-acteurs, multisectorielle intégrée pour le renforcement de la culture de responsabilité avec des cadres stratégiques institutionnels multi-acteurs mis en place depuis 2013 et entend poursuivre, renforcer les actions dans ce sens. Cependant, tous ces acquis sont fragiles dus au contexte malien. Et pour nous, l'un des leviers pour renforcer cette culture de responsabilité d'ici 2030 pour atteindre les cibles de 2025 et de 2030, dans un contexte de crise multiforme qui est celui du Mali, est le renforcement institutionnel de ces cadres de gouvernance avec la pleine participation de la société civile. En particulier, le Conseil national de nutrition, le comité technique intersectoriel et ses groupes techniques de travail, le comité régional d'orientation et de coordination et de suivi des actions de développement qui est le cadre au niveau déconcentré, et le comité locaux d'orientation et de suivi des actions de développement et le comité communaux, soutenus par un système d'information, parce que c'est de la prise de décision sur des bases factuelles pour la gestion des politiques et des programmes de renforcement de tous les panels en domaine de nutrition. Ce renforcement des cadres de responsabilité nous aide à identifier des obstacles en matière de performance programmatique et financière pour ne laisser personne à côté, que ce soit la partie gouvernementale, la société civile, les académies de recherche, les donateurs et la formulation des politiques et programmes multi-acteurs multisectoriels qui conviennent du mieux, qui est dynamique au contexte malien, parce que le Mali vit des moments de crise les plus importants. Et malgré ceci, je pense que ces résultats qui sont là, c'est l'effort de l'ensemble des partenaires qui ont une culture de responsabilité très forte. Et j'aimerais vraiment vous remercier ici à travers ce micro, l'ensemble des parties prenantes du Mali, sans aucune. Et aujourd'hui aussi, on va beaucoup remercier de son société civile qui suit 2 fois par an les engagements que le Mali a pris depuis les forums, les engagements de Nutrition for Group depuis 2013, aujourd'hui les nouveaux engagements aussi. Chaque semestre rappelle à toutes les parties prenantes la Tanzanie. Je vous remercie.
Thank you very much, Dr. Jibrin. We'll move straight to the third speaker, He Kran, Helen Keller International, Deputy Country Director, Cambodia. We are going to take this presentation via a video message. Thank you. Alexandra, you can proceed. Yes.
Good evening, Excellency, ladies and gentlemen. Sun CSA Cambodia comprised of 53 members, took significant steps to support the government in the enforcement of the press meal substitute code and to hold everyone accountable. First, we develop and distribute policy brief on the BMF code and evidence of illegal promotions and possible economic losses due to suboptimal breastfeeding to the decision maker, journalists, and the health workers. We launched a petitions campaign to collect the signature from the public to urge concerned ministry to strengthen enforcement of the BMF code. We submitted more than 13,000 signatures to the offices of the Deputy Prime Minister and the 4 other ministries for the considerations. We then supported this ministry to pilot a monitoring and reporting system to enforce the national BMF code. As a result, Sun CSA Cambodia submitted 32 cases of BMF code violation to the government for actions. Finally, Sun CSA Cambodia issued several public joint statements to denounce BMF company who violated Cambodia BMF code and approach the government strong actions against the violators. In recent years, strong action has been taken against violators. 40 warning letters were sent to the manufacturer or distributor in violations of sub-degree or BMF codes. In addition, monetary penalties were imposed upon 28 violators, ranking from $625 to $1,250 US. Recently, the government also cracked down on one company for the sale of 6 batches of product with misleading information on the label. In addition, during the COVID-19, the Minister of Health refused to accept donations around 80,000 cans of BMF formula from a BMF company. 17 development partners, including Sun CSA Cambodia member, WHO, UNICEF, World Food Program, FAO, sent a letter to the Minister of Health, congratulate him for his decisions on this. My take-home message is that the Sun CSA Cambodia play a very important role in supporting the line ministry to strengthen the enforcement of BMF code and holding everyone accountable for the responsibility. Furthermore, in order to protect and support breastfeeding effectively, there must be a strong national BMF regulation, along with an equally strong mechanism to enforce this regulation. Thank you very much for your attention.
Thank you very much, Gail Crime from the Helen Keller, who goes straight to Mike from the Stone USN Youth Leader Constitution. Please, Mike, you have 4 minutes. Thank you very much. Go ahead.
All right, thanks so much. My name is Mike Konga and I'm tuning from Malawi, and I'm the youth leader representing my country. So I will focus much in terms of accountability that young people have done, especially in terms of the activities which we have conducted. But let me also firstly say that as the youth leaders, we have been so much supportive of the SAN CSN alliances in our countries and ensuring that accountability is reinforced in government. And some of the activities that we have been taking are much focusing on the advocacy in terms of increasing nutrition resource allocation. And aside from increasing resource allocation to nutrition, we've been also really focusing in terms of budget tracking. That is just to show how much government is utilizing the resources in the expenditure analysis. So aside from probably putting hands with the CSOs in our countries, we have been able to do some of the activities on our own. For instance, let me just share an example of what Florence from Rwanda did. She trained nutrition champions in all the districts in Rwanda, and these are working government in order to improve adolescent nutrition and also developing strategies that will reinforce nutrition, particularly in adolescents. And aside from Rwanda, coming back to going to Kenya, our youth leader, Jane, has also did a number of training.
Very sorry to interrupt you, Mike. Can you hear me?
Yes, I can hear you.
There's quite a lot of wind. Maybe could you try to come closer to your microphone? We can hear you, but we also hear a lot of wind behind.
All right, are you able to hear me right
yes,
now?
it's much better. Thank you.
All right, thanks so much. So I was continuing that Jen from Kenya, she did training targeting young people in schools, and from her training, the good thing is the government, through the Minister of Education, the Minister of Health, they were able to support her and they were able to coordinate with her. So from that, I should be able to make sure that whatever government is committing should be materialized. And this is almost the same across a number of countries where the youth leaders are working. But let me also share my example that when I joined the youth leaders team in 2018, I never had any idea in terms of nutrition policies or nutrition strategies. But I think through the program and through the work of the SISONA, which is the SAN Alliance in Malawi, I've been able to understand the different policies that government uses in terms of addressing malnutrition, but particularly the committees or the platforms which government usually adopt when sending nutrition information and nutrition messages. But I realized that the committees, especially the platforms that are there within the communities to enforce nutrition or implement nutrition intervention, they never had young people. Something which was very strange because we know that if the youth really know, they have to understand nutrition and have to be part of the committees. And since I have to back up of the policies, for instance, the decentralization policy, which emphasizes that each and every development committee that is at a community level has to have a youth representative. Through that, I managed to convince the stakeholders, particularly the directors of program planning at district level, to ensure that every youth club in a community has a representative at the area nutrition coordinating committee or a committee within their area, so that they should be able to contribute to nutrition. So fortunately enough, this went well in the two districts which I targeted, and were able to champion nutrition in their communities, and also they are able to be part and parcel of every decision-making that the committee is doing within their locality. So these are some examples which young youth leaders have done in terms of accountability, but we'll continue working hard.
Sorry again, Mike, could you come even closer to your microphone, perhaps? Sorry to interrupt you.
All right, are you able to hear me right now?
Yes, that's better, thank you.
All right, so let me finish by saying that we'll continue to work in our countries to improve accountability and much focusing on supporting the nutrition accountability framework and ensuring that we also remain accountable. We'll present our commitments during the N4G and we ensure that we work with each and every stakeholders, increasing our networks, make sure that even the young people in vulnerable communities are able to be rich with nutrition information. Thanks so much.
Thank you very much, Mike. We apologize for the I think he's in an open space. So we'll go straight to the last speaker. Can you mute your mic, please, Mike? Thank you. We'll go straight to the last speaker, Ismail Bamo, Managing Director at Society Transformation. Please, distinguished participants, you can start dropping your questions on the chat box. We are getting closer to the Q&A session. Thank you very much.
Thank you, Mr. Aminu. Thank you all. Good afternoon, everyone, or good morning, depending on where you are. I'm Ismail Bamou. I'm CEO of Société de Transformation Alimentaire, founded in 2001, based in Niamey, Niger, West Africa. Company started with production of infant flour and RUTF first, covering somewhere around 5 to 10% of the needs in Niger. So about 10 years ago or so, we decided to reshape the strategy with the focus on accountability approach of how we can have an impact, and not only have an impact, but also cover 100% of the needs of the country. So about 6 or 7 years ago, we joined the Sun Business Network internationally, and started shaping the first strategy. And I'll get back to that and show how one of the goals we set ourselves was attained with working with civil society network here in Niger. So about 6 years ago, we had as a goal to cover about 100% of the needs of the RUTF and RUCF needs in Niger. Last year, when we look at the statistics, we had covered about 100% of what was needed in Niger. 3 million children was treated from malnutrition, stunting, and wasting included, which means that we went over the 100% that we had set as an objective in Niger. But to be able to attain that objective, we had to not only hire people. We went from 4 people working in the company in the year 2000s or whatnot to about 150 people working. We created activities around some of the raw material we use within the factory. Peanut is one of the main ones. So we created a generating activity around sorting the peanuts that will then be used to produce some of the RUTFs. And if you look at down the line, what we also did is focused on how we can impact the value chain of peanut production in the country. And therefore, when we look at some of the numbers last year, we actually injected all the way up to 4 million euros within the past 3 years, affecting a little over 8,000 people that had helped us in Niger throughout different countries, throughout different countryside of the country, to produce the peanuts that we use for the RUTF that is then used by mostly NGOs, which are UNICEF, Médecins Sans Frontières, WFP, etc., to send out and treat malnutrition, not only in Niger nowadays. So we also sent out to northern part of Nigeria, Chad, Mali, Burkina Faso, and about 10 other countries in the Sahel region. So because of probably time's sake, I would not focus on other key points that I wanted to point out, but I will straightly go. Alexandra, if you can go to the 3rd slide directly, and maybe talk about some of the things we were able to do with the civil society network here in Niger. I wanted to flag something out. Actually, civil society has been very, very important in how people think and talk about nutrition in Niger. By the time we joined the Sun Business Network in 2016, civil society had already been active in Niger for about 4 or 5 years. And then so they took on them to kind of help us go through the process of saying, hey, we want to create the Sun Business Network. STI, you have been talking about nutrition in Niger. You should probably start talking about nutrition with other businesses, and we will help you define a strategy, share for communication, fundraise when it's needed, etc., etc. An example of where we've been from going to, create the Sun Business Network to last month when we had a very interesting discussion with the Sun business members in Nigeria, where, Sun Civil Movement here in Niger has helped us raise some money to send business members here from Niger to Nigeria to look at the Send Business Network there, see what they are doing in terms of approach, and come back here in Niger and apply what are the best practices. There's also one other thing that I wanted to flag out that was very important to us. Fortification in Niger is quite very tricky. It's very, very complicated. You know, up until now, taxation about CMVs, premixes, and vitamins has been considered as being a luxury product. And then therefore, if you're in an activity such as ours, when you import raw material, vitamins, premixes, etc., so government thinks that you have the mean, it's a luxury product, and then therefore they'll tax you somewhere between, I believe, 50 to 55% tax, customs, etc., and duties, which obviously will make the product a little bit more expensive, which also means that then in terms of coverage, you will be able to produce less. So civil society has been very helpful in helping us shape a strategy on lobbying towards the government, because they have been collaborating on other spheres. And then last year, the government has accepted, because of this lobbying that's been ongoing for about 4 or 5 years now, it is not attained just yet, but it's a very important step. They have accepted to not only define a scope of fortification, first thing. Second thing, to look at if it's possible in terms of fiscality, to say, hey, you know, we will exempt all the premixes that are coming into the country or being used to fortify the foods the Nigerian people are using. Another key point with working with society, civil society, is that they've actually helped the country shape a strategy for the national political strategy of nutrition in Nigeria. Civil society movement has been very key and very important about it. Last but not least, civil society has asked the Sun Business movement to join part of their activities as being not only key member speakers sometimes, but also being interveners into some of the activities they do. I believe for the sake of time, I will just keep it short there for now, and then hopefully if there are questions later on, I'll take them on. Thank you very much, everyone. That was me.
Thank you very much, Ismail. I will move straight to invite Charlotte from the Global Nutrition Report, Senior Nutrition Policy Analyst, to present on equipping ourselves with the right tools. Charlotte, you're welcome. Thank you.
Thank you very much, Aminou. I believe, yes, thank you, Alexandra, as well, for the presentation. So good morning, good afternoon, everyone. My name is Charlotte Martineau. I'm Senior Nutrition Advisor at Development Initiatives, who is the host of the Global Nutrition Report. I'm presenting today on behalf of the GNR Independent Expert Group, and we'll speak about the Nutrition Accountability Framework, which is the first independent and comprehensive framework for registering smart nutrition commitments and monitoring nutrition action. So we all know the scale of the nutrition crisis we're facing, and I will not come back on it today. But one of the key challenges, and you've all talked about it already, is addressing this global crisis, is the lack of accountability. For example, when it comes to commitments, the formulation was complicated in the past, and the reporting burden is on commitment makers. So stronger accountability is what will translate commitments into action and impact. Accountability is everyone's business, and working on it together, we have an opportunity to improve it. The Nutrition Accountability Framework was born out of a recommendation from the Technical Accountability Working Group in 2019 and was endorsed by the stakeholders and government of Japan as the accountability framework for 2021 Tokyo N4G Summit. As you've heard from Dr. Ezoe in introduction, we need to commend the effort of government of Japan for their leadership on putting accountability at the forefront of the summit. So how is the NAF different from other mechanisms? It is the first time we have guidance before the summit, and it goes beyond the summit to cover all nutrition commitments. It is designed to record all new commitments on nutrition and set out requirements for smart nutrition nutrition commitments formulation. Critically, it is redefining how nutrition commitments should be tracked and how it has created a common system, language, and principles to unify monitoring of nutrition actions globally. Next slide, please. So we're inviting all stakeholders from every constituency around the world to make smart commitments to tackle poor diets and malnutrition in all its forms. Next slide, please. So how does this framework work in practice? You can see here the full cycle of nutrition accountability. Starting from the upper left corner, first you develop your commitment and then you register it on the platform online. This is what most of the stakeholders are doing at the moment. Once the commitment is registered, it is our turn to review how smart it is. Commitments will then be part of the compact document, which will be published by government of Japan, and then the commitments will be online on the GNR website. On an annual basis, you will report on your progress made towards the commitment using the online platform. The GNR will review the progress made, analyze, and report on it. The objective being to celebrate success, identify gaps in action, and share recommendations. You will then receive recognition, learn, and further strengthen existing commitments or make new ones. Next slide, please. So what makes the NAF, oh no. Thank you, this one. Yeah, the smart one. Perfect, thank you. What makes the NAF stronger is its methodology and classification. Using past experience, the experts have completely reshaped how we make nutrition commitments and detailed a methodology on how to make those commitments smart. And it is easier said than done. They developed a classification system to enable stakeholders to describe accurately the nutrition actions. Effectively, this is a taxonomy to name, define, and classify nutrition actions based on common principles and shared characteristics. And this enables all of us to speak about the same thing, measure progress, and hold each other to account. Next slide, please. I encourage you to have a look at the website where you will find more resources to read on the details of those methods, and you'll find additional guidance and FAQ. Next slide, please, and that will be the last one. So finally, and to bring us back to today's discussion, what comes next? I think we all agree, and especially listening to all the fellow speakers before me, our joint goal is to ensure that commitments should not be empty promises, and for that, accountability is key. The GNR will continue to develop the NAF and to report on progress towards the targets. This is the GNR report, as you know it, some of you, and the country nutrition profiles. We're launching them next week, so don't hesitate to contact us if you want more details on the launch. And we will continue to report on progress towards the commitments, and we'll report on progress from past N4G summits, as well as the new commitments that we're recording on the accountability framework currently. What the GNR does is to empower stakeholders to take action with data and information. We present how poor diets and resulting malnutrition can be addressed with research and evidence. We lead and coordinate the nutrition accountability framework in collaboration with existing mechanisms. So we provide tools to hold all the stakeholders to account, and we drive stronger nutrition commitments. In short, we inform, empower, and influence using best available data and evidence. But what we don't do is advocacy and direct outreach to stakeholders and decision makers. So how can you help? How can you come into the picture? Is by using GNR content, the NAF, but as well the other content and data, and get involved with us in the technical advisory working group on accountability to further develop the NAF. And if you want to know more about this group, we'll have a side event on the 16th of December to speak about it. So yeah, stay tuned. That is it for me. Thank you very much. And I'm staying for questions later. Back to you, Aminu.
Thank you, Charlotte. We already have a question right away for you from the chat box. The But please, distinguished participants, you can go ahead to be dropping your questions on the chat box. But there's already one which I want to call Charlotte to respond to. It's about how important is it to look beyond the 2030 goals of the SDG with health and nutrition? So this question, I think, Charlotte, you can go ahead to respond. And of course, all our distinguished panelists can also comment on the question. Thank you.
So how important is it to look beyond 2030? This is such a big question. I don't know if I can respond on behalf of everybody. So what we do at the GNR at the moment is to look at progress towards those global targets. And you're right, there are global targets that are set up until 2030. At the moment, there are no targets beyond 2030. At the moment, the GNR has reported in past reports that the progress was too slow. So the key question is, are those targets adapted to today? And are we going to meet the targets? I think this is what the GNR so far has been really questioning and reporting on. Now, should we be asking what will happen after 2030? Oh, I think this is something that maybe this is a question for the summit itself. I can't answer. I certainly think that we can do better, for sure.
Yeah. Thank you, Charlotte. I also agree with you. So 2030 is still a journey. We are still in 2021. We should all commit to ensure that what we promise regarding accountability for nutrition is achieved by 2030 and of course beyond. So let me also throw some questions to our distinguished panelists, particularly the issue of accountability. So it's good to hear from the panelists what governance is needed at a global and national level to promote accountability for nutrition. So I would like to hear from our distinguished panel speakers what governance mechanisms are needed at the global and national level, and how can the nutrition accountability framework support to strengthen these proposed global and national level mechanisms. So any of our panel speaker, please can jump in to respond to this question. Thank you. Ismail, do you want to?
Yes, Mr. Aminu, thank you for allowing me to quickly respond on this real quick. I believe in some of contexts, the voice of private sector is very much so unheard. And, you know, there's no multi-sectorial exhaustive response possible if there's not a way to make some of those policies through private sector. And I'm giving you a very simple example. You know, if for instance, for businesses that have awareness about nutrition are being taxed about something that would allow the country to benefit in terms of good quality standards products, and government does not know about it or does not hear about it or does not do much about it, then we have an issue. In my opinion, the voices, or at least the ways businesses can impact, is not enough put on the agenda, on top of the agenda. And I'm okay with maybe other networks have done some of the work, and now maybe it is for us to be held accountable on how we can take the fight a little bit more forward by taking some of the maybe goals into our own hands. Thank you. That's what I wanted to flag out.
Thank you very much. I'm seeing Dr. Jibril's hand up. Please, you can also proceed to respond to this question from your own country experience.
Concernant aujourd'hui, un des grands défis, il faut que aujourd'hui qu'on mette les communautés à la base en priorité. Parce que jusqu'à présent, nous sommes dans la plupart des cas au niveau central. Alors que toute cette question de redevabilité, de culture de responsabilité, c'est d'abord de ressort de la communauté elle-même. Dans mon pays, pour moi, le domaine le plus important pour faire cette culture de responsabilité, c'est au niveau des communes, c'est-à-dire que l'entité administrative à la base. Parce que là-bas, l'esprit de plus one est plus facile. Le sous-préfet, il est le détenteur de tous les pouvoirs. Il y a un seul cadre de planification qui est le plan de développement économique, social et culturel. Il y a un seul cadre de mesure de rendement et le coût est abordable. Cela veut dire quoi? Qu'aujourd'hui, même la fortification doit aller dans ce sens. Peut-être on peut avoir des zones, des régions, des trucs, mais de plus en plus, si on veut changer les donnes, atteindre les cibles d'ici 2030, il faut que cette culture de responsabilité qui est la première pratique de la gouvernance, la bonne gouvernance, puisse mettre l'accent sur la communauté. Et qu'aujourd'hui, même ces nouvelles technologies d'information et de communication puissent nous aider à les impliquer davantage avec les ressources dont ils ont, parce qu'ils ont tout pour faire changer cette question de nutrition. Mais je pense qu'on ne parvient pas à travailler suffisamment avec eux. Et la plupart des cas, que ce soit le secteur privé, le secteur académie recherche, le secteur peut-être gouvernement, on est toujours au niveau central. Et de ce fait, dans les politiques qui sont bien écrites, alors qu'aujourd'hui, nos plans de développement économique et social, que ce soit au niveau déconcentré, au niveau décentralisé, souffrent d'une sensibilité aux questions de la sécurité alimentaire, aux questions de la sécurité. Ne prenons seulement en compte que la sécurité en ressources en eau potable, nous pourrons changer fondamentalement le paradigme de la nutrition. Je pense que c'est important qu'aujourd'hui, la gestion sécurisée des ressources en eau potable puisse être une porte d'entrée pour la culture de la responsabilité, afin que nous puissions changer. Cela veut dire qu'on aura moins de malnutrition aiguë et de fait, nous ne serons plus. Voici ce que j'avais à dire sur ce point. Merci.
Thank you very much. May I ask Besinati to respond to one of the questions on the Q&A? Let me read one because I believe your presentation has touched some aspect of it. A question from a participant, how can we ensure that commitments reports are neutral and independent to ensure accountability? How can we ensure that commitments reports are neutral and also independent to ensure accountability? You can attempt to respond to the question. Thank you.
Okay, thank you very much. I'm not sure that I fully understand the question, but I think that at the end of the day, any commitment to any report, any pledge, any policy has to be transferred in what this looks like at the end of the day in the lived experiences in the local communities. And I think, linking it back to the question that you previously asked, what sort of governance can then link into those reports being transparent and accountable? I think demand-led governance has got a critical role to play. So the governance that puts citizens into the system as, yes, they're service users, but they're also citizens as claimants with critical information that can help improve the services that are due to them. So I think putting people right at the heart of it. And then with the reports themselves, ensuring they're accessible for people, making sure people understand the commitments that government is making and that there is a continuum of accountability right from the local to the national up to the global level. Thank you.
Thank you very much. Michael, if you are available, are you online still? Mike from Malawi? Okay, so maybe we lost him. Charlotte, please, you can proceed. There's a question also on the issue of most of the presentations, they are focused on country level accountability. So the question is, how do we go about ensuring international level institutions also promoting the accountability, at the same time also ensuring that it is done. So please, you can try and also make any comment you would like to do at this time. Thank you.
Thank you very much. I mean, I think it's a very good question. And I think this is why organizations and frameworks like the nutrition accountability frameworks are important in collaboration and as a complement to what you do in the field. I think today we've had a very good example that the examples given by my fellow speakers were examples at country level with the community. What the GNR does is looking at global level or even local level, and we store and we register all those commitments on the database. So it doesn't matter if you are a stakeholder, a civil society organization of a medium size based in a country, or if you are a UN organization with the HQ in Rome, your commitment is going to be treated exactly the same on the nutrition accountability framework. So the entity will be reported, the full commitment will be reported, and we will publish that on the website. This is how I think we can do accountability from the country level all the way to the international level. Aminu, there was another question in French in the chat, which is quite an interesting question.
Yeah, go ahead. Yeah, go ahead, please respond. Yeah, thank you.
The question is asking me, and I'm going to summarize it. I don't have to read everything. I'm not a good translator. But the question is really asking the efforts of the GNR and the N4G working groups in ensuring that we have the finances for this accountability, for the data. And I fully agree, this is a great point. So what we have done is that some of us have focused on developing this framework, but there has been some advocacy as well to ensure that the different thematic important to government of Japan were the ones leading the mobilization of stakeholders. So you know that it includes the UHC, so health, food and diet, resilience as well, but finance and accountability are two other cross-cutting themes that are in the roadmap of government of Japan. So there has been some mobilization to ensure that, let alone the systems, we have the funding available for this accountability. And I fully agree, this is something we need to continue to advocate for, because accountability comes with a cost, but it is a cost worth paying for. So I hope I've answered that question as well. Thank you. Back to you, Aminu.
Okay, thank you very much, Charlotte, and distinguished panelists and the participants. We're getting closer to wrapping up this very interesting and engaging webinar on accountability for nutrition for growth. I would like to give each of the panelists one minute. Please let us stick to the 1 minute. There's not a lot of time to give us your closing remark. 1 minute. Desnati, please, you can proceed. Have your 1 minute. Then I will call Dr. Jibril. Go ahead.
Sure, I'll be very brief. I think the main point is to ensure that you're looking at from the community going up, putting citizens at the heart of the solutions for nutrition services, for nutrition outcomes. And I would like to just underscore the issue of inclusion and ensuring that women and all those groups that tend to be excluded are part of the solution. Thank you.
Thank you. Dr. Jibril, please, can you have your 1 minute closing remark? Thank you.
Moi, je trouve que c'est une opportunité immense pour mon pays pour réduire la pauvreté, l'insécurité alimentaire, l'insécurité nutritionnelle, avec un travail décent, surtout au niveau communautaire. Cette culture de responsabilité, cette compréhension du fait qu'aujourd'hui, ces partenariats autour de la nutrition est oui, parce que c'est la seule intervention où $1 investi nous rapporte $16. Et aujourd'hui, les thématiques qui sont discutées au niveau global nous donnent cette chance, que ce soit pour le sommet sur le système alimentaire, que ce soit sur le sommet sur la nutrition, que ce soit sur le sommet sur le changement climatique. Je pense que tout ceci vont de pair et de ce fait, la culture de nos communautés, de respect de nos communautés porte à suffisance cet élément. C'est pour ça que j'aimerais que l'effort soit mis sur les niveaux les plus périphériques pour qu'on puisse changer les choses. Merci.
Thank you, Ismail. Please unmute yourself and let's hear your closing remark. 1 minute. Go ahead to unmute.
Thanks again, Mr. Aminu, and thanks again all. I believe we as a private sector, we have a responsibility to talk about the things we do a little bit more clearly and the objectives that we assign ourselves. And I'll make myself maybe a little bit clearer. In some of the contexts in which we work, the informal part of what we're doing as businessmen and women takes over what the formal sector does. And then therefore, part of the messages we want to send out are being pretty much not taken seriously because we are trying to hide some of the information that is needed for the impacts from all the movements to come together. So maybe our responsibility is to be transparent. I believe in, that's what, and that's how we're going to be able at some point to be able to not be talk about what we, some of the objectives we have, but also to be taken seriously. Thank you.
Thank you very much. Mike Kunga, please unmute yourself for your closing remark. 1 minute. Thank you.
Thanks so much. I really appreciate the conversation, but let me also say that accountability is a critical thing, and it's an ongoing process of which, for us, possibly as the youth leaders for nutrition, is something which is quite new, and we highly rely on the information that is given to us through our various platforms, especially the SUN CSA's Alliance. And let me also say that probably the nutrition accountability framework has also to be integrated into the already existing strategies within the countries, so that shouldn't look like a strange thing, but should just build from what our countries are doing, ensuring accountability. Thanks so much.
Thank you very much. So let me call Alexandra for any final remark or any announcement to make before I conclude the meeting. Alexandra, please, you have the floor. We still have some 5 minutes, so if you want to do the Mentimeter or you want to do a closing, you have the floor. Thank you.
Fantastic. Thank you, Aminu, and a huge thanks to our excellent panelists who gave brilliant examples on accountability at local, national, and international levels, and the collaboration with civil society, private sector, governments, and young people is quite impressive. So we will close now, as we said, with the same Mentimeter to see if you have different perspectives on what accountability means to you. So please go on the link that that Zoe, shared on the chat, and do let us know how you feel about accountability now, what it means to you. Does the significance has the significance changed after hearing those presentations? And as you type your results, I will share the screen, and Aminu will provide the closing remarks in a minute. All right, so we have a lot coming in. Let me pick a few. So I think we have the same understanding as before, except that we are informed by more examples. So we have, for example, trust and confidence. That's one I had already read. Being able to explain clearly what you are doing and responsible for. Governments and corporations value the needs of people over all else. Joint work to achieve goals. And commitment and actions that improve the lives of citizens. And I will now revert back to Aminou for the closing remarks, and we will save your results as well and send them alongside the presentations. Thank you, Aminou, over to you.
Okay, thank you very much, Alexander. We are just 1 minute to the 2:30 p.m. time. So I think we have done very well. It is my pleasure to thank the organizers of this meeting, led by Alexandra Newlands, at the Civil Society Network Son Secretariat in the UK for organizing this meeting, and also to thank our distinguished speakers and panelists that have joined today to make wonderful presentations and also contribution. And we should also thank the government of Japan for demonstration of leadership in nutrition for growth, accountability, and all the wonderful commitments they have made so far. And we also thank sincerely the distinguished participants who have stayed with us for almost 90 minutes in this engaging and exciting webinar on accountability for nutrition for growth. I'm sure we'll hear from the Secretariat after the webinar to hear some of the next steps and also the promises that have been made and also how to move forward in promoting accountability and for nutrition for growth. I would like to thank everybody, and also with this, I would like to close this webinar and to wish everybody, safe. We couldn't say safe journey because we are online, but wish you all the best in the remaining part of the day and the week. Thank you very much, and goodbye. Thank you.
Thank
Alexandra?
you, everyone. Thank you, Aminou, and a huge thanks to our interpreters as well. Yeah. Have a good day or evening. Thanks a lot.